my name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based here in Miami, Florida. And in my practice, I do a lot of testicle enhancement. A very common question I get here online is why? Why would somebody want to enhance their testicles? And it's something we really don't hear much about. Breast augmentation, breast enhancement, absolutely, we hear about this all the time. And it's not really a controversial thing whatsoever, but testicle enhancement can be somewhat controversial. And so in this video, I'm going to talk about the most common reasons we do this procedure, the techniques by which we do it, and sizes, all that sort of thing. So probably the most common patient I see in my practice is just a patient who's simply not happy with the size of their testicles. The two top reasons for this would be, number one, what we call idiopathic. It's just how the testicles developed and they are on the smaller side, and the patient would like an average or oftentimes big average size of testicle. The second most common reason patients will seek this is that they've noticed shrinkage. Shrinkage, the most common reason I see shrinkage happen is patients who've been on testosterone therapy. Oftentimes, over the months and years on testosterone therapy, especially if the patient hasn't taken HCG to prevent shrinkage, it can cause shrinkage, and some patients find that this is irreversible even when they come off the testosterone. Of course, many patients can't necessarily do that, so they want to go back to the size they were in the past. There are a subset of patients who just want a larger pair, and of course may have what we would call an average pair or a normal size testicle, but want to go bigger. In the United States, we have two different types of testicle implants. We have saline implants, which are most commonly used in the hospital, but in my practice, I prefer to use silicone implants because they're soft and I find tend to be a lot more natural and are tolerated much better. Oftentimes, the saline implants feel hard and basically not natural. So in my practice, we pretty much exclusively use the extra soft durometer silicone implants. There are 5 different sizes available off the shelf, meaning that we can order these at any time. They're delivered quickly, and these go up to about 5 centimeters by 4 centimeters. So these are pretty big and really about the biggest you would find in nature. However, for some of our patients, they prefer to go a little bit bigger. One reason for this is we use what's called the side-by-side technique. So basically we use the testicle implants to push back the native testicles and hide them. So obviously if you have an average size testicle to begin with, you need a big enough implant to hide it. So we have to take that into consideration, first of all, how large the native testicles are, and make sure that our implants can obscure it. After that, it's really up to the patient. I prefer when our patients are heavily involved in the decision making on the different implants. We can do different ratios of length to width and different sizes up until this is about the biggest implant that I've put in. This one is 7 by 5 centimeters. It's a model of it, and not every patient will be able to accommodate that. So basically how we decide size, if the patient wants to do custom implants, we do renderings of these. We let the patients know what the ratios are, the size to the width, the weight of the testicles, and of course the dimensions, and they are, like I said, strongly involved in that decision making. Sometimes patients will go for slightly different sized implants. It's very common that the testicles in the natural world are slightly different sizes, so they'll do that to reflect that. I have to say, out of all the procedures I do in my practice, this tends to be a very euphoric one. done, patients tend to be very satisfied with the results, and it's something we definitely enjoy doing. We're seeing new consults for this procedure, and we can do virtual consults. Most of our patients, because this is kind of not a very common procedure, do fly in from all over the world for this procedure. So like I said, we're accepting new consults, and if this is something you are interested in, just reach out. Usually the best way to get us is through the contact page on our website, which I've linked in the comments below.